Every life is invaluable and precious. When medical emergencies like a cardiac arrest happen around a person, it is important to be prepared. You can help someone in a medical emergency only when you're clear as to what is to be done in such a situation. If you are aware and informed, then you can take steps to revive a person and save their life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation, also known as CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness then and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It is even more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports actually show that majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. On the broadcast, we have with us Dr. Ankit Gupta, Assistant Professor, Department of Cardiology from Raebareli, AIIMS, and Dr. Ashish Deshpande also joining us this afternoon. He's a consultant interventional cardiologist at Orient City Care Super Speciality Hospital in Aurangabad. Also on the broadcast joining us, Dr. Divij Khetan, consultant interventional cardiologist from the Khetan Heart and Super Speciality Hospital in Rajasthan's Jaipur. Dr. Khetan, but it's still a grave shock to hear that an apparently healthy person underwent a sudden cardiac death during their time in the gym. How do we then understand it in this perspective?
Yeah, recently we are seeing many young patients, they are dying suddenly in the gym. Physical activity is very good, either as a profession or as your hobbies or as a sports activity. But the persons, those who are dying suddenly in the gym, they are usually having advanced heart disease and they are not aware of them. So the most common cardiac problems are the coronary artery disease, some hypertrophic cardiomyopathies, as well as arrhythmic heart disorders. These people, they are more prone for sudden death during the heavy exercise. Most commonly it is the coronary artery disease if you are above the age of 40 years of age. So if you are not doing regular exercises and you have a sedentary lifestyle, so you are more prone for sudden attacks as compared to the persons those who are doing the regular activities. So what I suggest, if you are having a heart disease and you have a sedentary lifestyle, better to consult a physician or a cardiologist before taking over any vigorous activities.
Dr. Divij Khetan, for those of our viewers who may be unaware, can you please explain the process of CPR and how it should be done?
Yeah, first we have to check if the patient is alert, is unconscious. We have to tap on the shoulder, we can shake the patient, we can shout at the patient. If the patient is unalert, we have to call for some help. We have to lay down the patient on the flat ground floor and then we have to start the CPR. First we have to keep our one hand over the center of the chest. We have to lock our hands on the back. Keeping our elbow at the straight, we have to start the chest compression. This is basically a bystander CPR. So what the compressions rate should be around 100 to 120 compressions per minute and it has to be around 2-inch deep. Don't press hard because it can break your ribs also. So we have to continue doing our CPR till the patient regains any consciousness or if there is any medical help arrives. So this is how we do.
Dr. Divij Khetan, is angioplasty or bypass surgery the only option to treat a heart attack? And if you could also brief our viewers on how safe it is.
See, the heart attack is 1 hour is the golden period. The earliest we open the arteries, the best we can preserve the heart. So angiography is the diagnostic test. If it is a blockage is there, it's a 100% blockage. We call it ST elevation MI. So we should open this by angioplasties. Depending if the patient has a multivessel disease and a very heavy calcified disease or there is very severe lesions are there, bypass is the second alternative. So in an acute heart attack, the first option we always prefer for angioplasty. This opens up the vessels very fast. If the patient has no option, if it's in the periphery, then we go for medical therapy where we thrombolize these attack patients with the drugs. So yeah, the first option should always be early intervention. Otherwise, the medical therapy is the second best option.
Right. Thank you so much, doctors, for joining us on the show this afternoon, and thank you so much all of you at home for watching.